A Pap smear, also known as a Pap test, is a simple yet vital screening procedure for women. It helps detect early signs of cervical cancer. Cervical cancer affects the cervix, which is the lower part of the uterus connecting to the vagina. Early detection through regular Pap smears has significantly reduced cervical cancer deaths. Pap smears are quick and relatively painless. They are usually performed during a routine pelvic exam. During the procedure, a small sample of cells is collected from the cervix. These cells are then examined under a microscope to look for any abnormalities. Early detection is key in the fight against cervical cancer. Precancerous cells, if found early, can be treated before they develop into cancer. This is why regular Pap smears are crucial for women's health. A Pap smear is a straightforward procedure that typically takes only a few minutes. You will lie on an examination table with your feet placed in stirrups. Your doctor will gently insert a speculum into your vagina. The speculum is a smooth, plastic or metal instrument that helps to widen the vagina so the cervix can be seen clearly. Once the speculum is in place, your doctor will use a small brush or spatula to collect a sample of cells from your cervix. This may feel like a slight scraping sensation, but it should not be painful. The collected cells are smeared onto a glass slide or placed in a vial of liquid preservative and sent to a laboratory for analysis. After the sample is collected, the speculum is removed. The procedure is then complete and you can get dressed. Most women experience little to no discomfort during or after a Pap smear. After your Pap smear, the collected cells are examined in a laboratory. A pathologist, a doctor specializing in diagnosing diseases by examining cells and tissues, will analyze the sample. The results of your Pap smear will indicate whether your cervical cells appear normal or abnormal. If your Pap smear results are normal, it means that no abnormal cells were detected. You will be advised to continue with regular Pap smears as recommended by your doctor. If your results show abnormal cells, it doesn't necessarily mean you have cervical cancer. Abnormal cells could be caused by various factors, including infections or hormonal changes. Your doctor may recommend further tests such as a colposcopy or a human papillomavirus (HPV) test to determine the cause of the abnormal cells and the appropriate course of action. Regular Pap smears are essential for women's health. They are the most effective way to detect cervical cancer early, when it's most treatable. Most women should start getting Pap smears at age 21 and continue until age 65. Your doctor will advise you on the recommended frequency of Pap smears based on your age, medical history, and previous Pap smear results. To prepare for your Pap smear, avoid douching, using vaginal creams or medications, or having intercourse for at least 24 hours before the test. These activities can interfere with the accuracy of the results. It's also best to schedule your Pap smear when you are not having your menstrual period. By staying up to date with your Pap smears and discussing any concerns you may have with your doctor, you are taking proactive steps to protect your cervical health. Remember, early detection saves lives. Subscribe to our channel for more health and wellness content.